So we continue with talks that's mainly ethics, but the perspective, you'll notice most of these cases you can actually look at it from a gazillion different perspectives. Now, if we start talking about a dozen ways of looking at things, that won't make for a very helpful session with me. So we try to focus on just a few ways of looking at things, and my hope is you get your own insights and or be interested enough to start reading and studying, which is really what I want you to do. Form your own insights and ideas and integrate it with the way you see yourself as a physician or as a care provider or as a nurse or as a medical practitioner. In that way, you grow up or become very ethical, very moral, helpful individuals in society, or be helpful to other people. At least from my perspective, that's a decent goal to. It's a good goal to look forward to. This case is very, very interesting because this is the kind of thing you worry about when you're a trainee, especially if you're already a resident or a fellow, and during your first years of practice. So your first encounters of a dying patient, not just a dying patient, your own patient dying. It's something you worry about. It's something you think about every now and then, but you try not to think about it. And of course, that's interesting because everybody dies. If you're trying to become a doctor or trying to become a nurse or a medical provider or a healthcare provider, you know everyone dies. And if you're taking care of sick people, some of them will be really sick and some of them will be dying. It's very unusual for trainees in this field to be scared or worried about these things. Even after they've already graduated, like, nursing graduates or medical school graduates, they still worry about encountering dying patients during their first years of practice or when they enter clerkship or internship and they're given more and more responsibility as far as patient caregiving is concerned or patient management is concerned. They worry about dying patients. I can't tell you everything. I mean, there's like a gazillion ways of reacting. But as in the previous session, we'll start with the idea of an oath, the Hippocratic oath. The idea is you'll react based on what you think of yourself or what you think of you as a physician. Your being reacts based on what you think it is. So where does the Hippocratic oath come in? Well, the oath defines the physicians. Oaths are very important until the 19th century, maybe early 20th century, especially in developing countries. In Western countries, things are becoming more modernized and more secular, and oaths and vows. You kind of swear to a Greek god like the Hippocratic Oath or God. When you talk about Judeo-Christian, Christian or Catholic beliefs, which is the predominant belief system in the developed world, in the West. And of course, our Western world defined what modern medicine is. That's pretty much what you're studying in school. Let's go to Hippocrates' time, the time of Hippocrates. So you're sick, and then you go to the temple, you talk to each other, and then you're sick, or a family member is sick, and then you go to one of these Greek schools who care for the sick, and that's where the Hippocratic school comes in. It's one of those schools in the Greek world that's like 2,500 years ago. There's like a whole bunch of schools. Well, it might be the only school in your place. I mean, it's the ancient world. It's not like one huge metropolitan area like, Tokyo or New York. Probably have this one, maybe two schools. But why do you bring yourself there or your loved one there? Because you have an idea that these are the people who care for people who are sick. Of course, in your mind, the gods made you sick, but you're asking for help, someone who would take care of you. And that's one of the schools. So that's pretty much how it works. Now, how do you get into the school? Well, you go in there and then it's apprenticeship. I mean, even medicine was apprenticeship up until the time of the modern university and the rise of medical schools and universities. Before, especially surgery, was more or less an apprenticeship. When family medicine started in the 1960s and they started talking about paying attention to dealing with people and communicating and psychosocial, and they realized that those are not the kind of things you just give workshops on or OSCEs or lectures inside an academic center. You actually have to follow a family doctor around and see how he does things. So it's still an apprenticeship. I mean, that's the way to learn those things. There are limits to what you can learn in a very controlled academic kind of setting. Of course, we have actual patients, but there's a limit to that. The professors come in and out, and there's a cardiologist, but they're very busy and they talk to the patients. I mean, in the 1960s, they talk more, but by 1970s, 1980s, that's pretty much gone. And the family medicine people are saying, we don't think that's the way to go, especially if we are dealing with primary care or community practice or family medicine or person-centered medicine. You have to watch someone do it every day in order for you to learn it. So that's an apprenticeship. Anyway, so you go in there and then you try to become one. And once they think you're ready, you take an oath. Of course, during the time you're learning, the ideas inside the oath, or the ideas of the oath, you're constantly bombarded by those ideas, right? And then once you're ready, you would take an oath. You swear to the God. Now, that's a very serious thing. I mean, this is not the age of science, the age of we don't believe in God. We just take the oath. We don't really know what it says, and it's something we aspire for, but nobody really aspires for it. I mean, we're not there yet. That's like the 20th century, 21st century, right? Or early 21st century. That's our time. So when you swear to the Greek gods, you're pretty serious. You know something can happen to you if you don't do what you swore to, right? So now, these oaths are internal matters. It's like secret societies. Yeah. So you don't tell the other schools of healing your little secrets and, how you run your school. And, that's why they say brethren, I take care of my brethren and my teachers are like my father, that kind of thing. So you swear an oath and then, and that's what defines you. Now, people don't really know what the oath contains, but then every time you move around and you treat people, they can sense what you're after. Now, later on, when the scholars rediscovered the Hippocratic Oath, actually it's in the 18th century, but it became very, very popular in the 19th century, and they decided that all medical schools should, after you finish medical school, you stand up and then you tell each other, announce to the world that you swear to this. It's what defines you, Now, of course, later on, you don't swear to the Greek gods. I imagine during the early years, they swore to the Greek gods, so that's a problem. You're not swearing to anything here. You don't believe that Apollo is real, right? So you're swearing, so it's like a rite of passage, but you don't really believe anything will happen to you if you don't do exactly what your oath says, right? Who's Apollo, right? You believe in the Christian and Catholic God, but that's interesting because early 20th century, they changed the Apollo thing to the Christian or Catholic God, and people start, taking an oath to God, right? But then later on, universities and then university medical centers started thinking that we're secular. God has nothing to do with this. We're very scientific and we're very secular. We don't teach religion. You go to a seminary for that. Then swearing to God doesn't mean anything at all, right? I mean, you walk around, you listen to your lectures, you try to become a doctor, and nobody talks about principles based on your oath to God, right? So it again became a rite of passage. You don't really believe that oath means anything, especially if you don't really believe God will do anything to you, right? Or especially if you see your teachers or consultants or trainers act as if it's okay not to act in accordance with their oath because they don't really believe in God, or they don't really believe God does anything. Atheists are agnostic, which characterizes pretty much modern medicine, the thing that we try to aspire for. So oaths degenerate into what you should be or who you really are, into something to aspire for, something to motivate you, to inspire you, something that inspires, something that motivates, something to aspire for. So it became like that. Well, anyway, so imagine you're in the late 19th century or early 20th century. You have a dying patient, your first few dying patients, and then you act based on your idea of who you are, and the oath is pretty much who you are. But during that time, you really don't believe everything that the oath says, because it actually doesn't have a lot of things to do with modern medicine, but you pick out certain phrases. You take care of each other. It's a very hard job. So it's an extrapolation of the brethren teacher thing. And then you try your best to do what's best for the patient. Very paternalistic, but that came from the middle part of the oath. But of course, it talks about a particular kind of intervention that the Hippocratic school does. And then you pick out phrases saying that you're not supposed to harm patients. You're not supposed to give poisons, and you shouldn't suggest interventions that would cause harm. Then you see this phrase, first doing no harm. So actually, you don't really follow each and every word of the physician's oath or the Hippocratic oath. You just, there's certain bits and pieces of the oath that gets highlighted during your medical school. So you see yourself as trying to do good and trying not to harm. And this patient's dying. And so it depends on how you see death. Now, 19th century and 20th century is still very religious. So you try your best. Just don't do anything that harms the patient. And if the patient dies, that's okay, because you took care of the patient, and that's what you're supposed to be doing. Everybody dies. It's it's still a very religious kind of culture. You kind of feel sad, but you don't really feel bad about it, and it doesn't cause a lot of trauma as far as trainees are concerned. Now, once you hit mid 20th century, things change, because it's very secular, it's very scientific, and there's no more religion. You might swear to God, or your teachers or consultants might swear to God, but a third of them or half of them don't really believe that. And even the medical school is different. 90+% of the time, they teach you stuff so that you can make the sickness go away. That's pretty much what it is, right? You go through the very small stuff inside the body, and then you have to cram your brain with so many concepts and terminologies. And of course, you have to do that because, you spent so much time and effort trying to get into med school. Failing would be the worst thing that can happen to you as far as you are concerned while you're in med school. So it's a very stressful thing. Cramming thousands of pages inside your head. Most of it you probably won't even use, but nobody says that. So by the time you reach clinics, there's M&Ms, like, how come the patient's doing this? What did you do wrong? Did you figure it out? Have you thought about what to do? Now, later on, the age of evidence-based medicine, which is 1980s onwards, it became very popular in 1980s onwards. Then, have you been up to date with what you know? Did you do something that's based on clinical trials? How come you didn't read this? How come you didn't know that they figured this out 3 months ago? How come you're still doing something that is already outdated? And then you stand in front and you're supposed to know everything. Of course, the trick to that is the consultant sitting there. How come you didn't read this? How come you don't know this? That same consultant actually doesn't know a lot of things. It just so happens that they opened your journal 3 days ago and found this article interesting. But anyway, that's not the topic. So you get grilled in front, and I guess it's like a rite of passage. You get to stand in front and people start grilling you. Maybe makes you more emotionally resilient. I don't know, but that's how they did it. I guess it would make sense because it started out as a little brotherhood. It's like entering the masonry or entering the mafia. It turn you into sterner stuff. Not all med schools are like that, but a lot of good ones were like that, especially in the 20th century. It's like boot camp. And some departments are worse than the others, but family med tried to do different because, it's family, it's social, and sometimes it doesn't work because people take it for granted. Anyway. So, how would you react if things are like that? Well, you react as if you failed. There must be something that you didn't think about. If you're a trainee or you're a resident and you're very responsible to what happens to this patient, and then the patient starts dying, and then you go stand in front, M&M, right? So, and then the idea is, what did you do wrong? How come you didn't figure it out? How come the patient died? Of course, the answer to that is, well, everyone dies. Even you will die. That's the real answer, but nobody talks about that. You failed because you didn't figure it out. The reaction is you failed. So you might not be good enough. You're not ready yet to become a doctor. Or you're a doctor, but you're not ready yet to enter our group of subspecialists. This patient died on you, so you're not prepared yet. And then you start, you feel bad. And the idea is, after you stand in front, you start studying, I guess, unless you get traumatized by the entire ordeal. Now, if things are so bad, you do your best so that you don't get to stand in front, right? So nowadays, In some hospitals, I won't tell you which ones, people try to refer to hospice right away before the patient dies. Why? Because if you stand in front, even the consultants don't know hospice or palliative care. In some of these developing countries where they're like 20 to 30 years behind as far as palliative care is concerned. And the other specialists have no idea what it is, or they're not even interested. They personally don't think it's real medicine. If someone's dying, first of all, they don't want to talk about someone's dying because it's failure as far as everyone is concerned, from the old consultants all the way down. The consultants who think like the old days, like, you try your best to take care of the patient, but everybody dies. Most of them are dead or retired already. So, you're thinking about doctors from the 1930s to the 1940s, maybe 1960s in developing countries. And most of them it's like 60 years ago. Most of them are either dead or retired, right? So everyone in the room don't want to talk about death. In med school, they don't talk about death. So you hate it. You're scared. You feel like you're a failure. That's your reaction. You stand in front, and then after you get grilled, or after you tell everyone how you didn't solve the problem, how your patient died on you, you go out, drink beer, and forget about the death. And then you go back to the same mindset, thinking that you can actually keep everyone alive forever, or you can save everyone, like demigod complex. It goes with a very paternalistic attitude of medicine. You can trust me, I'll make you better. I can take care of you. I know so much. It's a good thing you approached me, because I'm the one who's going to make you better. I know a lot. I guess it's also a coping mechanism for doctors. You're dealing with people who are very sick and people who are dying, and they talk to you and they're hoping that you'll do something. They're placing their lives on your hands, right? So to speak, whether they live or die. And that's a really hard thing to live with, right? Especially if you fail to keep them alive. Probably it's a coping mechanism so that you can keep on doing what you're supposed to be doing. Right? I think the way they did it in the old days is much better, because it's more realistic. You can't keep everyone alive. There's such a thing as death. And if you want something positive, maybe you should also keep the Christian Catholic belief that there's life after death, so it's not that bad. But then you're talking about pre-secular times, and unfortunately we're not there anymore. Something to think about. If you're the kind of person who's very religious still, spiritual, or very religious, and you think of yourself as living by your religious beliefs, or Christian or Catholic with spiritual beliefs, and you go through med school, you should be aware of the differences. It's something to think about, right? So that's the first reaction. You fail. You're not part of the group yet. You cannot take the oath. You don't live up to the oath. Of course, we all know by the 1940s, 1950s, what do you have? Mass media, right? Doctors don't define themselves, or trainees don't define themselves based on the oath. Actually, later on, we take the oath. We have no idea what the oath contains. They don't even tell us it's that important, right? The principles of becoming a good physician. We just look around, look at our famous consultants, especially the rich ones or the famous ones, and then look at the way they think and the way they behave. Maybe those are the principles. Studying the physician's oath, that's like 20 to 60 minutes of first year medical school. And it's pretty much all there is to it. Even the consultants don't repeat the oath. Probably half of them don't even remember what it contains. Of course, everyone knows first do no harm. And the brethren thing. Of course, sometimes it gets misused as a way of telling your colleagues not to squeal on you, because everyone needs to do something unethical or immoral every now and then to earn your keep, things like that. But anyway, so the oath doesn't define you anymore. So what defines you? By 1940s, 1950s, or in developing countries, you're talking about 1970s, 1980s, then it's like television all over the place. You're talking about media. So the doctor is not defined by the oath. The oath is just, a rite of passage. You stand up, you finish med school, you read it. You read it because nobody knows what it says. But the stuff in your mind is, I've graduated, I'm going to throw this toga thing, and I just have to recite these words. I don't even know how important they are, and that's pretty much the end of the story, right? So the thing that really defines you is how your consultants behave as far as the way they take care of patients, how they react when a patient dies, how they treat you in M&M when your patient dies. Your idea of being a doctor would be, what you see in television shows. Of course, 1940s, 1960s, doctors are pictured as, in the West, very gentlemanly, mild-mannered, mostly male, but then I think there are already some female doctors, but not a lot. of famous doctors on television are mostly males. And so it's still a paternalistic, I'm doing things to help you out, a very caring kind of doctor. Of course, every now and then you see movies that with evil, bad doctors, but if you ask around, they know it's just fiction. And their idea of the doctor would be the other doctor. And the television series is very good, very mild-mannered, and things like that. So that's pretty much the idea of medicine. It actually dictated the kind of modifications to the oath during those times. Civil, mild-mannered, caring, still very paternalistic. So they kind of feed on each other. The society thinks about doctors this way, or they hope that the doctors are still this way. They come up with television shows that show that's the case, and then the doctors try to become like that, or the doctors think of themselves as this. We're mild-mannered, we're caring, we're very civil. Goes along with the territory, because most medical schools, the people in their medical schools, even during those times, like mid-20th century, most of the people entering medical schools are part of the upper socio-economic classes. And so you're mild-mannered, very caring kind of doctor, helping this poor guy who's sick. And then they create an oath, and then they kind of feed on each other. The radio, television, and the oath, right? Or the doctor's perception of themselves, right? Of course, that's mid-20th century. By the time you reach late 20th century to the 21st century, doctors are already different, right? Anyway, it's still the same thing. You try your best, you take care of the patient, but then it's very scientific also. So the idea that you failed, you still feel very bad as far as you're concerned. Now, 50s, 60s, there's two streams already, like the university medical schools or university system are becoming more and more secular, but then the Western world, especially the United States and Northern America, there's this Christian revival movement. So it might have influenced some doctors. Actually, a lot of well-known, very good pioneers in primary care and family medicine are very spiritual and very religious, so it influenced that core group. But then medicine in general is going in the way of materialism and secularism. Anyway, so by the late 1970s onwards up till now, it's different. So that's we're not talking about oaths anymore. We're talking about contract. So by the 1960s, there's this idea of it shouldn't be paternalistic. You see the rise of relativism and subjectivism. You, the doctors, might have your own values, might have your own ideas as far as life and death and what's good and what's bad. But then I, the patient, the individual patient you're dealing with right now, also have my own ideas about my own values, about what should be done and what should not be done. So you have to ask me. It's not enough that I trust you, that you know a lot, that you know much more than what I know, and you do your best to do what's good for me. We don't accept that anymore. I should be given a choice. And then there's the informed consent. So it's a contract. We agree. You tell me, I approach you. You can offer me certain services, and I decide whether I want your services. And if you're going to offer something that's very risky or prolong my life, but it might, as far as I'm concerned, it might just prolong my suffering, or it's not really beneficial, then we have to talk about it, and you have to get my consent. We agree, we negotiate, and then we put it down on paper. So that's a contract, right? And it started out pretty okay, because medicine is becoming more and more detached. Once you become secular and you view human being in a materialistic way, then attachment to the person, being responsible to another human being, caring, compassion, and empathy, just slowly but surely, these things become less and less important. Because what's the role of compassion and empathy and caring and being humane when all you need to do is just, study the human body, try to figure things out, and come up with the chemical or the drug or the surgical procedure to fix the patient. That doesn't require compassion and things like that. You just have to be smart enough, and you just have to figure things out. That's the power of science, right? So medicine became more and more detached. Pretty soon, even that kind of detachment reached the primary care and community medicine level, right? So you look at the primary care clinics or community medicine clinics, what do you see? Are they focused on lifestyle management and living well, which is what's more important at that level? Even the pioneers of general medicine and family medicine and primary care think that's really what's more important. Are they concerned about public health and lifestyle? No, they're concerned about trying to detect each and every person with a blood pressure above 140. Later on, they lowered it to 130, and giving them the right prescription for the drug so that they keep on buying the drug and they become healthy. And then they spend 1 or 2 minutes trying to tell them healthy lifestyle, but nobody really cares. Of course, by that time, corrupted commercialism has already entered the big academic medical centers, and then decades later, it already filtered into the primary care and setting, right? So the medical representative keeps on coming into your clinic, giving you goodies and telling you if you need some sponsorship so that you can go to a conference in Europe or the Bahamas or in Hong Kong or whatnot, because you're such an expert in taking care of diabetes or hypertension, you just swallow it. So morality goes down the drain. Anyway, that's not the topic. So it's a contract, and a contract is good as long as it's aimed at something that benefits the patient. It's aimed at upholding good values. Contracts are good if its goal is to uphold something that's good. So unfortunately, just a few decades after that, the rise of informed consent, mutual decision making, comes the rise of commercialized medicine. And of course, the medical industry became one of the biggest industries in the world, rivaling even oil. So money flowed in. And once you have lots of money flowing in, then it's just a matter of time when people become more and more corrupted. What do I mean by corrupted? To corrupt is to turn something that's good and ideal into something that's less than what it's supposed to be. That's how to corrupt something, right? So you can corrupt institutions like medical schools or any kind of academic institutions. You can corrupt medical care institutions. You can corrupt students or medical trainees. To corrupt is to turn something into something less than what it really is. Or to corrupt a young mind is to turn it into something that's less than what it's potentially supposed to be. And of course, if you hold on to Christian or Catholic beliefs, corrupting young minds is one of the worst things that you can possibly do, right? So first, it's a contract, and it's negotiation. Well-meaning, but that only lasted for a few decades. And then it's a contract with a commercial flavor to it. And then you come to the reaction that's very common nowadays. So what's the reaction? Well, my patient dies, but that's part of work. They came in, we agreed, I tell them their options, they wanted this, I gave them the service, they paid me for it. They know that there's no 100% guarantee that they'll survive or it will work, but they accepted it, so it's not my fault that they died. So the detachment that started, the personal detachment that started during secularism, moving on to subjectivism, relativism, and then you have the commercialism. It's full blown, right? So they paid for it. I told them, this is the next product I can offer you. That's only 20% successful. So that means 8 out of 10, you'll still die. Do you want it? Then you agree to it. You sign it. You pay me for it. But if you die or it doesn't work, that's not my fault. So I'm not too concerned about that. Nothing very personal. That's where you find modern Western medicine right now. That's the reaction to death. Now, of course, if you're in a developing country that's more religious and spiritual, it might not be that bad, but you're getting there. Especially if you're in the big metropolitan area institutions aspiring to be as modern and as advanced as the very secular Western or Westernized countries. Then you're already there. Not just the knowledge, but the culture that goes along with it. So the oath is gone, and suddenly what you have is the contract. Now, of course, the psychosocial people and the community medicine people, the idealistic ones in those fields, will say there's such a thing as a social contract. But that's not what we're talking about. This is a commercial, business-like contract. Right? I should want to point out, once you say, oh, it's not my fault, we agreed and we shook hands, they pay me for it. What does that mean also? I'm not responsible. See, I'm not responsible. I'm not accountable. And then you go to the worst case scenario. If everything is commercial, how does the business world work nowadays? I mean, in the old days, you try to give good service, or you try to make a good product so that, people will trust you and keep on getting your services or buying but how is it right now? It's not like that anymore, right? You try to come up with a product that people will buy and run with the money. I mean, you don't need to be honest. You just need to be successful. You just need to earn. Honesty is great if it's going to add on to your earnings or your income. But if it doesn't, then if being a little dishonest will get you more material benefits or prestige or fame or whatever, then all the better. That's the new business model, right? That's the reason why the Western world is having problems right now. I mean, honesty is gone. Honesty in business. I mean, that was mid-20th century ethic. So now, once it enters medicine, then you're really in trouble. And I think it already has entered modern medical care. I don't need to tell you the truth. I don't need to be honest. I just need you to sign the piece of paper and agree to my services and pay me for my services. That's all that matters. You just do it in such a way that it doesn't look terribly illegal. Or even if it is unethical or illegal, it's okay as long as you don't get caught, right? That's the modern business ethic, right? So modern medicine mixing with modern business ethics spells trouble. Now, the reason why I'm telling you this is because sometimes if, while you're trying to prevent yourself from drowning, while you're trying to keep yourself alive in medical school, because it's so hard and you're so stressed out, these ideas enter in your brain without you knowing about it. I mean, for some of you. Now, for the very smart ones, then you're probably not that stressed. And you can keep yourself afloat morally, ethically, as well as academically. So that's good, but not everyone is like that. Only like 5 to 7% of the class. So just be careful, because nobody's watching out for you as far as your ethics and morals are concerned. Anyway, we should probably end there.